The pancreas quietly shapes how we age by regulating digestion and blood sugar, two systems central to long-term health. It performs two essential roles: an exocrine function that enables digestion and an endocrine function that balances blood glucose. These functions influence inflammation, nutrient availability, and metabolic stress, all of which are major drivers of aging. In this documentary, we will examine pancreatic structure, the exocrine and endocrine systems, how aging affects the gland, and practical prevention steps. Our focus is evidence-based, emphasizing measurable interventions that preserve function and reduce frailty with age. First, we begin with structure and the exocrine system that enables digestion and nutrient absorption. The exocrine pancreas secretes digestive enzymes labeled lipase, amylase, and proteases that break down fats, carbohydrates, and proteins. Efficient enzyme output ensures nutrient absorption so the body receives building blocks for repair, immunity, and energy. Lipase digests fats, amylase handles starches, and proteases cleave proteins into amino acids used for tissue repair. As people age, pancreatic enzyme secretion can decline, impairing absorption and increasing risk of malnutrition and frailty. Identifying pancreatic exocrine insufficiency early and treating it can restore digestion and improve strength in older adults. Clear data graphics here show enzyme decline with age and the resulting drop in nutrient absorption and functional reserve. The endocrine pancreas contains islet cells that release insulin and glucagon to stabilize circulating glucose levels. Insulin lowers blood glucose and helps cells take up glucose for energy and storage in muscle and liver. Glucagon raises glucose when needed by signaling the liver to release stored sugar during fasting or stress. When hormonal balance fails, chronic hyperglycemia leads to diabetes, increasing cardiovascular disease, neuropathy, and mortality risk. Maintaining glucose balance reduces metabolic stress and chronic inflammation, mechanisms closely tied to accelerated aging. We now turn to lifestyle and medical strategies that support endocrine health and preserve longevity. A healthy pancreas reduces metabolic stress and systemic inflammation, two central mechanisms driving biologic aging. Dietary strategy matters. Fiber-rich foods, balanced carbohydrates, healthy fats, and adequate protein support pancreatic function. Regular aerobic and resistance exercise improves insulin sensitivity and reduces pancreatic strain over time. Medical monitoring is essential. Regular glucose tolerance tests, lipid panels, and assessment for exocrine insufficiency catch problems early. Targeted therapies, including pancreatic enzyme replacement and glucose-lowering medications, can restore balance when appropriate. Combining lifestyle measures with timely medical care preserves nutrition, reduces frailty, and supports long-term resilience. Chronic alcohol use, viral infections, gallstones, and metabolic stress are common causes of pancreatic injury. Ongoing pancreatic inflammation impairs both enzyme and hormone production, shortening healthy lifespan if left unchecked. Age-related decline in secretion can accelerate malnutrition, weakness, and loss of independence without appropriate management. Protecting the pancreas means limiting harmful exposures, managing weight, controlling blood sugar, and seeking timely medical care. The pancreas is a linchpin of longevity. Supporting digestion and glucose control translates directly into healthier aging and preserved function. Prioritize pancreatic health as part of preventive care and lifespan planning to preserve function, independence, and quality of life.